What causes a person's joint to go bad? There are many reasons, but probably the most common is the natural deterioration that we call osteoarthritis that afflicts many millions of Americans and leads to many visits and certainly many hospitalizations. Other than the natural deterioration, there are conditions such as inflammatory arthritises, the most common of which is rheumatoid arthritis that leads to deterioration of joints, and then trauma to joints can damage the joints and ultimately lead to problems that cause the joint to deteriorate.
When you're young as an athlete, paying attention to your muscles in orthopedic care is critical. Keeping balance and strength between all the muscles around your joints protects the joints. If the muscles are weak, the joints can wear out faster and possibly lead to total joint replacement.
We prefer to see older patients because the longevity of the implant is to some extent more likely to last the remainder of their life, but certainly many younger patients have benefited from joint replacement surgery if conservative measures have failed.
If you have an injury which is keeping you from doing your athletic performance or your regular activities of daily living or your hobbies, and you've already been treated and sought medical attention and it's not getting any better, then you need to come see an orthopedic surgeon.
The orthopedic surgeon can assess the joint by clinical examination, by obtaining a history from the patient, and by looking at x-rays. Once the joint has been evaluated in that manner, the recommendation may be for a joint replacement. However, the ultimate decision is on the part of the patient. Prior to the surgery, there are many non-operative things that can be done. Modifications of lifestyle, weight loss, the use of various anti-inflammatory medications, injections into the joint, drugs called hyaluronates, which are lubricants that can be inserted into the joint. But if those have failed, then the option is for joint replacement. This really depends on how much pain and the level of disability and what the functional expectations are of that patient following the surgery. What types of materials are used in artificial joints and how long do they last is a question that we are frequently asked. The use of materials is generally metals and plastics. We now use some ceramics to implant into high demand in younger patients, but the gold standard at this point is still metals and plastics. How long does a joint last? We have many patients that have over 10-year survivorships and some that have exceeded 20-year survivorships with total joint replacement.
After you have surgery, rehabilitation is probably 90% of your success. If I build a car and you don't drive it, it doesn't matter how good the car is. I can only be as good as you as a patient do your rehabilitation.
The better conditioned the patient is before the surgery, to some extent, the better and smoother the rehabilitation goes after the surgery and can shorten the transition back to a normal and healthy lifestyle. The joints are made for pain relief. They're not made for extremely heavy activities. But many patients resume recreational activities such as golf, cross-country skiing, aggressive walking, and certainly exercising in gyms, bicycle riding, and those types of activities.
Excela Health Orthopedics is a commitment of 5 local orthopedic surgeons. They have recruited fellowship trained in sports medicine as well as total joint replacement. The local ties to the community as well as the local access and the convenience are essential to good patient care. We're your neighbors, we're your friends. We're excellently trained orthopedic surgeons that can provide excellent care on all levels.